Hey, what do you think, Gretchen? Should we begin?
I think we're ready.
Okay. Well, I'd like to say good morning again to everyone who's joined us. My name is Leslie Edstrom, and I am the Director of Grants, Planning, and Program Development for Age Guide. Thank you for participating in today's Needs Assessment Findings and Results presentation. Please, if you haven't done so already, locate the chat button on the bottom of your screen and enter your name. And if you're from an organization, please write that in too. If you are joining us as an interested community member, you can just say Age Guide Friend or state your connection to Age Guide. Before we get started, I have two housekeeping items to cover. First, if you haven't received it already, we will be sending all of you the needs assessment report that this presentation is based on after the meeting. Second, we have muted all of you to avoid background noises and disruptions. At the end of the presentation, we will take questions. However, please also feel free to use the chat feature to ask questions along the way, and we will try to answer as many as possible at the end of the presentation. At this time, I would like to introduce Gretchen Knowlton, Manager of Planning, Advocacy, and Program Development. Gretchen has led the community needs assessment process for Age Guide, and we'll be sharing our findings with you this morning. Gretchen?
Thanks, Leslie. So nice to see so many familiar faces on here. It feels a bit like a reunion because many of you attended our listening sessions this past winter in which we gathered just like this virtually. But our goal today is to share the findings of our community needs assessment with you. Many of you are already familiar with Age Guide, I know, but just in case you're new to us, I wanted to tell you just a little bit about us. At Age Guide, we empower older adults to age well with dignity and independence by providing a range of services that address individual needs, such as meals, transportation, and caregiver supports. And we also advocate for older adults and weigh in on policymaking at all levels. Now, in preparation for fiscal year 2022 and 2024 area plan cycle, Age Guide engaged in a 5-step planning process to assess the needs of older adults, caregivers, and their families in our 8-county region. The first step in that planning cycle is to assess the needs of older adults and their caregivers, which we do through assistance from our board of directors, our advisory council, our staff, community stakeholders, and partners like all of you, which helps us to develop the area plan, which in turn is our guide on how best to distribute the federal and state funding for Older Americans Act services throughout our service area. And the second step to this planning process is to evaluate the existing service system. And that is where the needs assessment comes in. I'd like to take a moment to get just a little bit of audience input. So look at the bottom of your screen and go to the reactions button. And I'd like to know if you participated in an Age Guide listening session. If you participated in just one listening session, please raise your hand using the raise hand button. And you should be able to find that at the bottom of your screen where it says reactions. Oh, good, good, lots of hands raised. Now, if you participated in more than one, select the party popper, the celebration icon. I know that a lot of you participated in several because you cover several counties. And so yes, I see a lot of you did participate in several, lots of hands raised. Now, how about if you can't remember if you participated or not? I mean, we all have COVID fog, right? Go ahead and put the open mouth face of shock that you forgot. And that is totally okay. We still love you. Nobody's going to admit that they can't remember if they participated. Good. Excellent. Thank you all so much for participating. That was a lot of party poppers and hands raised. And without you, we would not have all of the data that we're going to be able to discuss today.
Kind of curious.
In its needs assessment activities, Age Guide took into consideration older adults in greatest economic and social need, with particular attention to those low-income minority older adults and those with limited English proficiency. In addition, we prioritize diversity, equity, and inclusion to examine how easy or difficult it was for diverse older adults to access our services. So to apply this inclusive lens, we researched existing assessment tools and searched to see what other agencies on aging around the country were doing in order to capture that type of data. And we selected an award-winning model that was used out in Washington State, that they used to best capture the input of communities of color, non-English speakers, and LGBTQ communities. And we kind of modeled our assessment tool off of theirs. Assessment tool that we chose had a methodology with diversity built in at its core. So we applied that to design both a survey and a listening session format. Listening sessions and survey questions were both organized around 10 service categories based on Older Americans Act and other federally funded programs. So these 10 service categories that we discussed, we cover in this presentation today. First, let's talk about the listening session. By the numbers, we had 25 community listening sessions around our 8-county region, and we had 250 participants. And overall, Age Guide staff spent a total of 36 hours listening to the community. Listening sessions were held, of course, virtually due to COVID-19. Not ideal. We would have loved to gather together. It worked out pretty well. Sessions were held for each of the 8 counties that we serve, with 2 sessions for the more populous counties. And knowing that the virtual platform was not real conducive to full participation by anyone with internet connection, or comfort with technology was an issue, HCAT made an extra effort to engage especially older adult participants in the listening sessions. And we did this by partnering with some of our funded partners and senior centers and other programs that were already engaging with participants online through online programming like bingo and parties. And we tagged on to that, and we did some listening sessions specifically with older adults. And this was extremely successful and resulted in extensive feedback from older adults. In addition, Age Guide held one listening session that was specifically to capture input about non-English speaking older adults from diverse backgrounds so that we could identify any needs for this underserved group. That listening session also gathered input from some paid and unpaid caregivers who worked directly with that population. The type of data that was collected from listening sessions, as you can imagine, was all qualitative, meaning it's individual anecdotal data that was gathered from people's conversations. And this perspective data is really useful for noting trends and common discussion themes, groupings. It's not as conducive as to aggregating into totals and percentages and graphs and that sort of thing. But that said, we learned a lot from these sessions about the themes, the challenges and the needs that people were expressing, and you'll see that detailed in the following slides. Top 3 challenges that we heard about in the listening sessions, particularly across all service categories, were technology, need for cultural support and services in a language other than English, and how the COVID-19 pandemic has affected older adults, as well as the services that are available to them. So I'm sure you're not surprised to hear any of these things. Those of you who are working in the field of aging know that these are themes that come up. But it was interesting to hear the types of discussions that were had around these things. And of course, COVID is at the top of everyone's mind right now. And this COVID-19 discussion focused a lot on the social isolation issues, the increased demand for home delivered meals that we've seen, and the challenges of providing aging services under the restrictions that we needed to have in place. I am seeing in the chat that people are asking if we're going to share the slides afterwards, and yes, we will. I had meant to record this as well. Katie, if we're not recording yet, can you record it? And then people could also listen to the recording, because there's going to be a lot on these slides. So I appreciate you asking about that. I forgot to tell you that we will share the slides with you. So if you don't catch all of it as it was past you this morning, don't worry about it. We will share it with you. All of this data is also in that full report that we sent to you. We sent it out yesterday. You should have that, and we'll send it out again afterwards. Transportation was the most talked about topic in every single listening session in every single age guide county. Now, I don't think that surprises any of you either. And, it's hard to say what exactly that means. It could mean that it's the greatest need among all service categories that we discussed, or it could just be something that people like to talk about. The data doesn't actually tell us that, but I think it's safe to say that transportation is on people's minds because there are some serious gaps and needs in service. And we'll be talking more about transportation when we get to the service section. Within this transportation category, participants indicated that there's a real need for increased availability of transportation, types and flexibility of transportation, and then of course, affordability. It's the top of people's minds. Now, next, I'm going to do a little poll for you. I'm going to put up a polling question for you. And I'd like you to use your mouse to answer this question for us. Now that you've heard what the listening session participants thought, what do you think is the top challenge for aging services in our region? So I'm going to give you the same top ones that respondents chose: technology, language and cultural barriers, COVID-19, transportation, or if you think it's something else. I'd be interested to see what folks think, and I'll just leave the poll up for a couple more seconds. Lots of transportation, a little COVID, a little language, pretty much technology as well. A few folks thought perhaps there's something else, it looks like. So I'll just give you a few more seconds. People are still sending in their comments. Okay, I'll share the results so you can see. Transportation definitely rises to the top for all of you as well. That's what we saw in the listening sessions as well. 24% technology, and a bit of language and cultural barriers and COVID as well. So that's interesting to see that you're tracking with what our respondents said as well. Now, these words on the screen are what's called a word cloud. If you haven't seen this before, it's based on codes that we created when we analyzed the data. Larger the word, the more often it was mentioned in the listening session. So this is one way to kind of figure out what rose to the top of the conversations in terms of importance. Surveys, which we'll talk about next, help to provide some more context around these words. We can see that these are all the themes that emerged. We've broken out details on some of the more common words, as you can see on the right side, and we have some details on what was discussed most often around these common themes. So again, you see transportation was about availability, flexibility, and affordability. Meal discussions focused mainly on home delivered meals, the congregate sites, and nutritional contents of the meals. Discussions about COVID talked about the restrictions, how the services had changed, and the challenges of COVID. So this just gives you a window into some of the major conversations that percolated to the top in the midst of our 36 hours of listening. Next, we're going to move on to talk about the survey and the survey responses. How many of you filled out the survey? Please use the reactions again down at the bottom of your screen and raise your hand if you filled out a survey for us. I think this number will probably be a little bit lower. Great, we do have some hands raised. Thank you to those of you who took the time to do that survey. We really appreciate it. And for those of you that didn't, you probably didn't because you had participated in a listening session. Survey data was collected through an online administered survey using the platform called SurveyMonkey. Many of you who participated know that this platform is very user-friendly. It takes you through the survey questions really easily. We broke the survey into those 10 sections by service category. It provided the quantitative data that we needed, specific responses. So that kind of data is useful for calculating actual percentages of participant responses, as well as demographic data. The reason we designed and distributed a survey in addition to those listening sessions was to gain input from a wider cross-section of the community. This was an easier way to capture those who weren't people participating online in our listening sessions, and people who needed the survey translated into a different language as well. Listening sessions were not so conducive to that. The survey was designed to be inclusive and equitable and to capture results from a wider range of stakeholders. The survey was translated into the 6 most common languages in our region, according to census data. So we partnered with some diverse community leaders and with the Coalition for Limited English Speaking Elderly, CLEAS. Thank you very much to them. And they helped us distribute surveys to their clients. And overall, the survey captured input from over 465
escalated it to management and you're waiting for a couple more hours, but
If everybody could mute themselves, that would be great. Thank you. Interestingly, our surveys seem to achieve the desired results, and survey respondents were largely older adults over the age of 65, which we were happy to see. 90% of the survey participants had not participated in a listening session, so we really captured a lot of unduplicated in the survey, which was what we were hoping for. The top 3 counties with the highest percentage of respondents were DuPage, Will, and Lake. So shout out to those 3 counties. Nice job. As I said, the survey was translated into 6 different languages in order to promote accessibility. We had paper copies of the survey that were available upon request for people who didn't want to go online and fill it out. Of the 466 responses, we had a really nice sampling of the wider community, as you can see from this slide. About 19% had a military background. 19% spoke a language other than English at home, which is a really nice high number considering that only 9% of older adults in our region, according to the census, speak only another language other than English at home. So we captured more than just those who have English language barriers. We also captured people who have some cross-cultural experience but speak English fairly well. And that's what that number tells us. 75% of our participants were white and 25% were non-white. 82, the vast majority were females. 4% did not identify as male or female, but rather identified as LGBTQ or other. 27% live alone, which, as we know, is a risk factor for social isolation. So we wanted to capture that group as well. And finally, 11%, another nice number, were caregivers. So really a good cross-section of the aging community. Across all the service categories, non-white participants and participants of color reported a little bit differently. Non-white participants reported not having used the availability services more often than white participants did. So what this means is that people of color are less likely to access our services. So we know that, and we have some statistical data to back that up now. And this could be connected to language and cultural barriers that came up in both the listening sessions and the survey. On the screen are some examples of common comments we received from Black and Brown participants. I'm not going to read all of these to you, but again, we'll share the PowerPoint with you after the session today. The theme of language and cultural barriers was really persistent in the listening sessions, especially within the categories of transportation, nutrition, and mental health services. The qualitative data from the listening session and the quantitative data from the survey responses both supported this need for language and cultural barriers to be addressed. The first of the service categories that we covered in the survey was information referral and outreach services. More than half of the survey respondents reported that they know where to get these services, which is good, and more than 50% of the participants also said that this was a very important or extremely important service to them. Now, what element of information and referral was most important to respondents? Accuracy of the information provided was rated as most important. 64% rated accuracy of the information as extremely important to them. That was one of the highest numbers that we saw across the survey. Out of participants who used the service of information referral and outreach, most of them specified that their needs were met. However, Option of needs somewhat met was a close second to this, which is something I think to keep an eye on, that needs were somewhat met in a vast number of people. We have to kind of unpackage that and figure out exactly what that means, and it might warrant some more exploration. Three most identified needs under this category were transportation, which we'll talk about again later in more depth. Outreach, many people are still not aware of all the services and resources that are available to them, such as what they qualify for. And mental health services. We heard a lot about the need for more for adults and caregivers to be able to receive mental health services. Before we go on to the next slide about nutrition services, I want to put up the next poll for you. And I'm going to ask you to tell us what you think was cited as the most important about nutrition services. So this isn't your opinion. It's sort of like a Family Feud, if anybody remembers that game show. What do you think the survey said was most important about nutrition services? The choice of menu, social interaction, in-home meal delivery, well-being checks. What do you guess people thought was most important to them about nutrition services? And you're not getting graded on this. So just take a guess at what you think respondents might have thought was most important. Give you a few more seconds. Everybody get your mouse out and pull up the survey and let us know what you think was the most important about nutrition services. Okay, I'm gonna end the poll and share the results. And most of you thought, or the majority of you thought, in-home meal delivery was going to be the most important. Choice of menu was a close second. So let's see what this survey says. The two most important nutritional health services identified were in-home meal delivery. So if you picked in-home meal delivery, you were right. And well-being checks with meals was a close second right behind that. So 27% said in-home meal delivery was most important. 26% said those well-being checks were most important. So you guys were pretty on track with what the respondents said. I think well-being checks was a little bit of a surprise to all of us. And that may be because of what's going on with COVID right now and people being so socially isolated, that those well-being checks have just risen in importance to people over this past year. In terms of specific nutritional health services, large proportion of respondents said that they had not used this service before. Between 33% and 41% had never utilized nutrition services. So this has implications for outreach, and I think is particularly interesting in light of the fact that everyone over 65 was considered homebound during COVID and can qualify for these meals right now. And perhaps people don't realize that they would qualify for that. So that's something that's important, I think, for us to note. Four main overarching things that were mentioned when participants were asked if there were any nutritional health services that they felt were lacking or that they needed were socialization or congregate dining. And this was, again, likely the result of our congregate dining sites being closed due to the pandemic. So it's that darn COVID-19 again. And cultural meals, folks felt were lacking, specialized dietary meals. And again, COVID concerns came up specifically in terms of waiting lists and increased demand. So I think people were aware of the fact that a lot of people were homebound and were needing this service, and there's concern as to whether it was available. I do want to pause from the survey results to say that we do have meals available for anyone who needs them, and people should contact either Aid Guide or our funded partners if they know somebody who needs a meal, because we don't have a shortage of that right now. In terms of healthy aging services, about half of the participants noted that they know where to find healthy aging services. And these are those kinds of education and health promotion programs. Of the other two choices, people could respond that they didn't know where to find the service or that they have not used the service. Participants were pretty much evenly split on that. So about 29% of people said that they didn't know where to find health promotion services. And that's a little bit disconcerting. Under the specific healthy aging services listed within the survey, ease of access and availability was rated the most important. So 35% thought just knowing where to get these services and being able to access them was really important. And of those who have used healthy aging services, most reported that their expectations were met, which was good. Not very many said that their expectations were exceeded. So we still have work we can do. Next, we're going to talk about caregivers and caregiver support. So I'm going to put up another poll for you. So let us know what you think was the top need for caregivers in our region. Again, this isn't about your opinion, but what do you think respondents said? What did the survey say? Family Feud style. Survey says. I'm seeing a lot of responses about respite, 70% almost thinking respite. Think about what the folks you work with would say caregivers need. All right, I'll give you one more second and I'm going to end the polling and I will share the results. As you can see, respite rose to the top. You're guessing that people are going to say respite and caregiver support groups. So let's see how you did. Survey says the answer was respite care services. So you read your communities well. Respite care was considered most important. 63% of participants indicated that caregiver support and education services were very important. The identified needs or gaps in this area were listed as respite caregiver services overall, adult day services such as adult daycare, and again, that's been closed due to COVID, caregiver support groups to build that personal connection and to have someone else to just share stories with, and resources for taking care of family. And that also probably due to COVID and more people bringing loved ones home from long-term care facilities. So you guys were tracking right on with everyone else. And I'm going to do one more poll here and ask you to tell me which service you think was used the least out of our remaining 3 services: mental health and counseling, legal services, or veteran services. What do you think the most respondents said that they had never needed or used? Yeah, give you all a few more seconds. You're all doing a great job of participating. I appreciate it. This is almost like we're doing yet another needs assessment here by asking you these questions, but it's kind of fun to see if you can guess what the respondents said. All right, I'm gonna end the polling, share the results. You said legal services. Almost half of you thought legal services would be the least used. And very close second, mental health and counseling. A small percentage thinking veteran services. So survey says counseling and mental health was the least used service. A little bit of a surprise there. However, when asked how well the survey met their needs, 75% of participants actually responded that they had not used any counseling or mental health services before. They were just asked if they had used this service before. We didn't get that high of a number, but when we asked how well the service met their needs, and one of the options was have not used the service, 75% of them said that. So it's almost like people were a little bit embarrassed to admit they hadn't used it. But this is also a very high statistic, and it's rather alarming, if not just surprising, likely due to the stigma that remains around mental health services, especially for a population that values independence and self-sufficiency so strongly. And at the same time, about a third of people also rated counseling and mental health services as extremely important to them. So there's a recognition that the service is needed and that it's very important. There's some disconnect here between the need and the use of the service. That is definitely something that we'll need to continue to look at. The 3 main identified needs in this category: outreach of the service, getting more information out, advertisements, awareness of what is available. And that definitely speaks to this issue of people not using the service. That could really help. Counseling in multiple different languages was listed as a gap. This points back again to the cultural and language barriers that were mentioned within the listening sessions as well as in the surveys. And then people said that finding mental health services that are applicable under restrictions of Medicare and Medicaid is challenging, and they need to know what providers are available for them, what they qualify for in terms of low cost counseling and mental health services. So again, it's that getting the information out about the available services that's going to be so important. As stated in the listening sessions, transportation services received lots of feedback from the surveys. Transportation topics were also mentioned under other service categories. So no matter what we were talking about or surveying about, transportation ended up coming up. When we talked about aging services, information and referral, and health and wellness, particularly transportation came up as a gap in that service. Common areas that came up in terms of needs for improvement: accessibility for people with disabilities and those who don't speak English well, long wait times, or the need to schedule rides way ahead of time, which isn't always feasible for participants. Affordability of public transit and private transportation options like Lyft and Uber were mentioned as barriers, and perhaps a not familiarity with the low cost options available through aging services. Addressing the limitations of township boundaries came up frequently. The need for rides that go greater distances, such as to a doctor's office outside of a residence county, and low availability of rides due to COVID was also mentioned, and hopefully we'll start to see some improvement in that area. 3 counties identified an especially strong need for increased transportation services. That was Will, DuPage, and Kane. So that's something for us to look into in those counties specifically, but it really came up across all of the counties. These 3 had the most responses about transportation. Legal services. 72% of participants specified that they haven't used any legal services before. So again, another really high number, and many of you in the survey knew that. So again, what can we do about this? We may need to do more outreach, make sure that people are aware of what's available to them. The most important legal services identified were legal advice and where to find affordable lawyers, as well as Medicare, Medicaid, and SSI denial assistance. And those are things that legal services can address. It's just a matter of helping connect people to those services. The veterans services. As you know, Age Guide has the Veterans Independence Program that we work on with the Veterans Administration hospitals. Do we have any veterans on this call? So would you mind raising your hand and identifying yourselves so that we can appreciate your service? Maybe don't have any specifically on this call, but we do appreciate the veterans that we had participate in the survey. We did have 19% of the respondents with a military background, as mentioned earlier. So those who have served in the military or who have family may not be surprised to read that within the service category, the top 2 services rated as most important were benefits and healthcare for veterans. These identified needs really focused around access to services through the Veterans Administration. We heard that those can be limited and difficult to access. We also heard that family members need help accessing services for their loved one, the veteran. And access, again, here to mental health services can be difficult to get, with something that we heard frequently. So overall, there seems to be a need to promote these services and to help veterans access them. I have one last poll for you. Which service do you think was least well known? Not necessarily least accessed, but just people didn't seem to know about it. I'm going to launch this poll for you. Which service do you think was least well known? Veteran services, housing services, or abuse prevention services? Which did respondents say they did not know how to access, or the service, they didn't know where to get it, or they just didn't access it. I'm seeing a lot of abuse prevention guesses, some housing service guesses. Give you a few more seconds. Okay, I'm going to end the polling and I'll share the results. You all indicated over 50% of you figure that abuse prevention services are the least used services, and it's possible that you are correct, but the survey says that housing services, according to the analysis and the people who participated in this survey, housing services were least accessed of all the services in our service. In our survey, the percentage of participants who reported that they know where to get housing services was one of the lowest percentages when compared across all the service categories. Affordability, community, and safety were identified as the most important aspects of housing services. And some of the needs related to housing services were affordable housing, more Section 8 housing, housing that's accessible for disabled older adults, such as those in wheelchairs or who can't walk up too many stairs. Long waiting lists for affordable housing needs to be addressed. So again, these barriers could be why this survey was rated the lowest in terms of use, because there are so many barriers to obtaining affordable housing. Now, a lot of you selected abuse prevention service as being unused, and it is possible that there are some reporting errors in this, that people choose not to report whether they're using abuse prevention services because of the stigma around this. So you may be right, and those of you working in the aging services know this better than anybody else. But in terms of our survey responses, abuse prevention services were the least used service. However, these services, which include advocating for older adults to ensure optimal quality of life, and there were some needs identified in this area. Service itself, aside from needs, but the service includes three basic areas that we delineated in the survey: ombudsman, long-term care facility services, adult protective services, and abuse prevention, which includes the investigation, intervention, and support for abuse or neglect. The identified needs within each of these service categories included increased awareness and education in terms of signs of abuse, as well as types of abuse. So again, the community awareness and information critical for this category, and information on where and how to report abuse. So I know we talked about this in each of the listening sessions as well. And often when asked, if you knew somebody who was being abused, would you know where to call? And people weren't really sure. We heard the same thing in the surveys. So it's possible that people do know about abuse intervention services. As somebody said in the comment, the idea of abuse prevention is a bit more abstract. Gail, I think you're right. Abuse prevention, like what exactly is that? Maybe I don't know, and I just answer I don't know on the survey. So that may have affected our results as well. So that is the last slide that I have on the survey results and the listening session results. And I would love to invite you all now to put your questions in the chat, or if you are comfortable unmuting yourself, you would like to go ahead and share your question with us. We have lots of time left, and we'd love to have this be sort of a dialogue where we can talk through some of these findings, maybe even brainstorm a bit on what you heard as challenges and what you think we might be able to do to address some of these challenges. We've got such a great group here gathered together from community, from our board of directors, from our funded partners. You guys are the experts on this. Are there some areas where you think we could bring about some change and some ways we could affect some of these needs? You're quite clear today. There aren't even very many things in the chat yet. Well, I can remove the chat. Good, I'll stop sharing so that we can all see each other. Did you take it down? Thank you.
Gretchen, I see that Gail Walsh has raised her hand.
Yes, I guess I was interested that in the legal services findings, and I know our staff is working really hard to try to get information out to people and to work with providers. And I think it's been really challenging in the last year or so with COVID doing that. But if there's input that we can get from other providers about how to make legal information more available, how to educate people about the kinds of advocacy we do, we would love to get that input and be able to be responsive to it.
I appreciate that.
I had a question, Gretchen.
Yes.
The tool that you used looked outstanding, and I think you said it came from Washington State?
From the Multnomah Area Agency on Aging.
Okay.
That's the Seattle area, I believe. Or Portland, sorry. Seattle.
Is that a, well, the numbers though, you have a small data set size. So there
Right.
were 250, I think, participants in the listening sessions, and then
Right.
you have maybe
And
450.
over 460 in the survey. Right. So overall, that statistically, that would be a small data set. You're right.
And then I don't think that there was there any from Kane County or not? I know.
Yeah, we had respondents from all the counties. Yes.
Well, my only concern is what's missing. And I'm sure you're going to take that into consideration moving forward. And I think the whole thing is marvelous, but it is a small data set. And so how can we make sure our data is representative of the area is the only thing that I would look at from an analytical point of view.
Right.
And to that end, would we not say that this is great information for us to get us started on the conversation, and then it's a great place to hand the baton, if you will, off to the funded partners to look into what kind of responses that they're getting from the people that they're working with, their participants in their programs, to see if the responses that they are receiving align with what we have found with the people that we've surveyed, to see where they're fitting in with this and how well it tracks at the agencies where our funded partners work or the community partners work.
Is that your next step then, Leslie? Is that what you're saying?
Well, I'm making that as a suggestion to take this information and to apply it further. If you're concerned about what the responses look like, or you want to find further data, our next step with this process was to take our findings and look at them in a deeper way in our public hearing document, and to apply some of this in our public hearing document, what we've learned.
Okay. All right. I wasn't criticizing.
No, I don't take it as such.
Thing.
No, thank you. No, not at all.
Yeah, I was just wondering what
Yeah.
you all at Age Guide were planning on doing with
Yeah.
this
And
information
I
moving
do,
forward.
I think you make a great point, Marilyn. We have such a large region.
Yes.
You know what I mean? And it probably goes back to Gail's points and to everything. It's how do we get to people to hear what they're doing? And I think to really talk about, to just reiterate Leslie's point, is that's why we always look at our funded partners to make sure that they are surveying their participants too. So again, what are they getting out of the program? But then we've got that big group of people that Gretchen pointed out that don't know about the services, right? So then it, goes back to Gail's question, is how do we get information to people, and how do we do it? And then we also benchmark a lot of what we do against what we see nationally. So while this is one part of that needs assessment process, we're also looking at what does Meals on Wheels collect, data wise, for the nutrition programs. What are we looking at ACL and the National Association of Area Agencies, and seeing nationally what the trends are with the programs too. So this is just a step in it. And it was a very ambitious step, I think, on the part of Age Guide to really get out there in the midst of COVID and hold virtual listening sessions and be able to try to garner that. The idea of we would have loved to be able to come to community dining sites and be able to do listening sessions, right at the participants that were doing it. And we were fortunate that a couple senior centers did allow us to do listening sessions with their seniors virtually to be able to really garner that too. But yeah, as Gretchen kind of said, COVID kind of reared its head here and really limited some of the things we could have done. And so I would love to see in 3 years that the data set grow for what we could do with this, because I don't want to make false assumptions on any of the data that we get out there. So.
Well, I think it was a magnificent undertaking, and I really applaud you all for doing it. And I know DuPage had, I mean, again, I would have liked 50% of our seniors have that we have as clients participate, and there was a very small segment. But I think that DuPage had the most participants, but I know the ones that did, and I think they were primarily from an underserved minority group. They were just thrilled to have participated. So wouldn't it be great to really engage that kind of energy across the board, and then see what happens. I mean, see what results happen. So congratulations. I just to Gretchen. I mean, she's just been smiling through this whole thing and making everybody feel excited about it. And I just want to, I couldn't wait to hear what the results was today.
Thank you, Mary Lynn.
Thank you so much, Mary Lynn. And I think this is a good starting point for lots more discussion. I think you're right. And I am hoping to do some blog posts and to delve into this data a little bit more and do some research on, what other statistics and national data are telling us about these kinds of services and what that, how that compares to our data. So stay tuned, because we're not really finished with this analysis yet. We've got all this data now. We'll be using it over the coming years to do some more exploring and some deeper dives into this data, and we'll share that with all of you. Also, if any of you do plan on doing some further analysis with your communities, we would be happy to share with you the methodology and the tools that we used to apply this diversity, equity, and inclusion model. So let me know if anybody is interested in pursuing this. Age Guide would be happy to help you do some surveys of your own or some listening sessions, and we would be happy to support you in that. Marjorie, I see your hand up. Thank you for waiting so patiently.
Oh, you're welcome. I am a senior advocate. I do it personally, one-on-one, and I'm also on State Senator Karina Villa's Senior Advisory Committee, where we're writing legislation for seniors. And for the last 10 years, I have had to use transportation, and I think the survey is correct. It's a key to everything else. And what I find, because I am blessed with a sound mind and able to navigate this, it's cumbersome and fearful for people. And like you said, I moved to another township, another county, a whole new set of rules that you have to figure out where you can go and that you can't take a bus across the street. And so it's frustrating, and even presentations are cumbersome. And I have people coming to me afterwards saying, what? But people I have helped, because I have a stack of research on all the counties, are so blessed if I present it. And I think that gets you to mental health, that gets you to social interaction, and then makes people, seniors, less dependent on society for services. Because if you can take a bus to a picnic, you've got that interaction and you're healthier.
Right.
And even in cognition, and if you can get it to the mental health services easily. So I think transportation is a core, especially in the 5-county area. And I found that with services too, cumbersome for people. A simple flow chart, like I'm sick, so go over here, or I need food. And I think that would satisfy because of the cumbersome. But thank you. I think the survey was excellent and it really showed what people need today. Thank you.
Thank you, Marjorie. And you're a great advocate. And I think that's really key as well, is that older adults want to hear from trusted sources. So hearing from you and from peers in the community about resources, and that this is an okay thing to ask for, and it's okay to, to go use a service. That's really important. So you're playing a really important role. And I think making those connections is something that the Aging Network wants to be able to do more of, is to connect people with each other and to provide that support from within the community. But yeah, transportation, that's been a tricky one for a long time and will continue to be, I think.
And I think what is interesting today, because of longevity, you have seniors with parents in their 90s.
Yeah.
I'm 72, and people who are caregiving and may have needs themselves for people in their 90s. So that is complicated for them.
That's right. Yeah. And that caregiver role just continues on then. Yes. So important. Thank you, Marjorie.
Welcome.
I see another hand up, Terry Wilcoxon.
Hi. So thanks everybody for this conversation. That's always really good. We're way out here in Woodstock, so we're kind of in the boonies, and we've gotten to know Marla and Leslie through our involvement with the Metropolitan Mayor's Caucus, Age-Friendly Community Collaborative, which has just been tremendous resources and networking opportunities. So I just wanted to share with you that we did just recently complete our action plan. And we are certified age-friendly community until 2024. So we're really proud of that. I just wanted to follow up on what Marjorie was bringing up, because the transportation out here being even more rural is obviously a very big issue. So you guys are doing a lot of really valuable work determining and validating the needs. And then my challenge, I guess, and question is, where do you go with that information? Because I'm with the city of Woodstock, and we're pretty progressive when it comes to looking at a lot of different things, but we're still reactive government. That's what government is here for. We respond to the needs of the community. And if we don't always know what those needs are, we're just keeping up with everything else on our plate, especially the past year. But transportation is such a complicated issue. And, where is it most effective to take this information? Municipalities can only do so much. Then you're going to the county. That's kind of a more centralized area for the regional effect. When you get to dealing with things that have to go along the state routes, then you're dealing with IDOT. Well, good luck there. So, but to look at what's possible on a local level, and how you get the funding to implement more of that door-to-door service, the shuttles that take you from different places, the minibuses, whatever those kinds of options might be. Those are the kinds of things that, if you can put together a presentation, and then that can be given to the municipalities, that will really raise the awareness of what's going on out there that just isn't always coming into the inside situation. So I just wanted to kind of throw that out as something that, think about what the next step might be, and then have some ideas. And then anytime that those ideas can have funding options attached to them, boy, then you've got a project. I mean, then you've got something you can really work on. That was my whole motivation for getting the age-friendly program adopted here. And now we're on the verge of being able to start a senior center with Door Township, which nobody had ever figured out how to do before. So it's pretty exciting when you can finally bring those things together, but the funding is really the key. So thank you. I'm on my soapbox now.
Yes. Thank you, Terry. And we're taking notes here. And these are also being good ideas, but I think this discussion is critical for that reason. We have to think about what we're going to do next, right? Where are we going to take this? So we've got some information. We need more information probably, but we also need those resources. And we've been talking about transportation for many years, and it may be time to start doing things. And I think you're right. A multi-pronged approach is probably the best way to look at it, working with government agencies, working with the municipalities, working with the providers. There's also the advocacy side of things and legislation that might be able to be pushed through, as well as the private funding sources. So very, very helpful discussion. Thank you. Are there any other hands up? Do you see any hands up, Leslie? I don't want to miss anybody, but there are some comments as well. The comment about promotion, that I'd like to see promotion of age guide and senior services centralized and promoted via basic channels like city utility billing. You could do paper and digital, from mayors and governors as champions to get the attention of at-home elders, especially those who are most isolated. So some of those partnerships, I think, are going on in some of our counties already, but those are great ideas and good channels to get the information out. And we could definitely do more of that. And I think that now that we have this new information, it's an impetus to try to get this information out there through some of these sources again. So thank you for the reminder about that. Other comments? This is your chance to share some ideas, maybe do some brainstorming. Marjorie, were you going to add to that?
I just wanted to add a personal story a gentleman told me. I think when you get it personal, it makes a difference. His mother-in-law was going to have to be put on Medicaid and put, enter a nursing home. He worked on it for 6 months to go through, because at first she was sick and could stay at home, to find the direct agencies, had to stand in line. This was before COVID, fill out all these forms, then found they had to transfer her estate to get her on Medicaid, then find a nursing home that he felt comfortable with. And the poor guy had tears in his eyes when he was talking to me. After all this, she got in the nursing home, had a stroke, and passed away after 2 weeks. He said he was going through so many emotions because of the tension of the 6 months he worked at it. He said, I'm sad that she died, but I'm also angry, all my work of all these months. And so, it just shows how it can get so complicated for people.
Mm-hmm. That's an important story to share as well. I think people need to hear that and to know that that's a unique story. It's one person's story, but it's also a common story. And those stories are really important for us to share. Thank you. We've talked a lot about transportation. Anybody want to chime in on some other services, that anything you found interesting or any ideas that you have?
There's a few things in the chat,
Okay.
Gretchen. Britta had commented, I think awareness and having an advocate to help elders navigate would be especially helpful. Youngers that are tech and information savvy, there will be this digital divide for a few more decades until the digital native age, and that's cute. And all information is easily accessible via technology. And don't know if you wanted to comment that, since that was one of the big themes, that one of the things that we are going to be addressing as a local initiative in the next 3 years will really be this digital divide, and really looking at how intergenerational programs can really play a role in helping older adults navigate technology, help. So that's something that that was one of our big takeaways as well through this needs assessment. And so I just thought I would acknowledge that one.
Yes, that's a good one. And we have, kind of started to experiment more with this concept of being an ambassador or helping people navigate as we worked on the census outreach. All of the funded partners did a lot of census outreach and helped people navigate through that process. And now with the vaccine, right, the COVID vaccine, we're all finding ourselves needing to be navigators for people again. People who are technically challenged have had a really hard time accessing the vaccine. I think now that has opened up quite a bit more, and most of our seniors are getting vaccinated, but it was challenging at first, right? And we really saw the value of coming alongside people, helping them access the technology and the need for them to learn how to do that, and for us to put that technology into their hands so that they can be independent with that and teach them how to use this technology is really important. So we'll definitely be focusing on that more in the future. There's some more messages here. Let's see. Shout out to the Lake County Townships, a great resource for senior transportation services. Don't forget, right? Just need to let people know about it. And let's see, medical appointments aren't the only transportation needs. That's true. However, there are some physicians who are aware of the difficulty for seniors to get to their offices for follow-up appointments. So yeah, even doctors are finding this to be a challenge to get people to their offices and are kind of trying to help too. So that might be another resource, working with the healthcare community on transportation. Somebody is suggesting that Age Guide hold weekly half-hour presentations on topics by various funded agencies. That sounds like fun. I like that idea. That would be great. We can get you all involved, get you on here with your information and knowledge to share with everybody about things that are working and how maybe you're addressing some of these particular challenges that came up in the listening sessions. That would be awesome. I think that's a great idea. We'll look at that. Are there any grants that would be introduced soon? Well, we'll have to take a look at what kind of funding is available outside of the usual channels. And yes, if people want presentations or more specific information, reach out to me, let me know how I can help. Other people like that idea of presentations as well? All right. Will we take this information to other community agencies, maybe those outside of the usual suspects in the aging network, right? Medical providers, business owners, et cetera. Well, we've got this report now. So I guess I would throw that back out to all of you. If you can help us to distribute this report to get the information out, share it with, your funders, share it with your local community partners, share it with your township and your local leaders. Get this information out there. And now you've heard the presentation, the community. You could certainly, any of you on this call could certainly present the findings even better than I could. So I would encourage you to be those advocates and to go out there and share this information as well. And we're happy to help you and support you in that however we can. Thank you for that suggestion. I think it's time to rally the troops. I think that's a great idea. Good discussion today, folks. I appreciate everybody weighing in. And I know some of you already spent a lot of time on several listening sessions. So I really appreciate you coming today and sharing with us. If you have other ideas and you want to send them in, feel free to share them with us. We'll save all of the transcripts. We've taken notes and we'll be paying close attention to your ideas and suggestions going forward. All right. Leslie, did you want to do the wrap up at this point? Should I put the slides back up?
I don't think we need to put this, well, maybe we do, so then people can see how to get in touch with us. But I want to be sure before everybody leaves to take a moment to really especially thank our funded partners who have been instrumental in helping Age Guide connect with older adults in our region for both the listening sessions and the survey. They are the people that work directly with the older adults and encouraged participation from the people that they work with on these listening sessions, and also for participation in completing the surveys. So we are so appreciative of their support. It was invaluable. And before we go, I want to remind you all, those of you that don't know, I want to also let you know that we have lots of tools and resources to help you keep up with the latest on what we're doing and what's important to older adults and caregivers. So I want to encourage you, if you haven't done so already, to engage with us on social media. And as soon as we end this discussion this morning, please continue or sign up to follow us on Facebook and Twitter. And you'll see that on those, we post important articles and resources and notices about events in the area. Lots of great information. So be sure to connect with us on social media. And then there's our monthly newsletter called the Aging Report that is full of useful information as well. You can sign up for that by going to our website under news and events, and you can sign up to get them sent to your inbox. These are ways to collaborate and advocate for older adults and to also stay in touch with Age Guide. And finally, I'd like to again thank you all for joining us and for all of the great insight you gave us on the chat, and also by sharing your thoughts with us today. We want to conclude the presentation now, and we hope you found the information helpful. And again, we'll be sending the PowerPoint and the report again out to everybody who's joined us today. So thank you all.
Thank you. Bye.
We'll probably stop recording.
Oh, yes. Thank you.